Representative Van Zandt, you're recognized in debate.
Thank you, Mr. Chair. I want to say, first of all, that fear is overshadowing our nation today, largely because of what happened last night, especially after the attempt to force mandates upon us as Floridians by last night's theatrics. And as every medical practitioner knows, fear leads to anxiety and panic attacks. We have two doctors on our panel today that could testify to that. Secondly, Scripture tells us truthfully that when expectations are destroyed, it maketh the heart sick. Our psychiatrists and psychologists today have defined that as depression. Mandates, therefore, are already in less than 24 hours imposing anxiety, panic attacks, and depression. And I am personally having an adverse reaction to all kinds of mandates here today. And I personally commend Representative Playkin and co-sponsor this bill with him, and just commend him for this good bill that will help us defend ourselves against mandates and protect our sovereignty as Floridians, and will set an important precedent to help us identify that all this federal help is actually in the form of money that originally belonged to Floridians.
Yes.
Thank you, Mr. Chairman.
Thank you. Representative Proctor in debate.
Thank you, Mr. Chairman. Mr. Chairman, those of us who support this resolution might be cast in the role of wanting to deny health care to children. I would reject that claim on the basis that we spend billions of dollars in Florida trying to provide health care for as many citizens as possible. That's really not the issue. This is much broader even than health care, in my view. The issue is, what are the limits of federal authority when it comes to imposing demands such as what a citizen will or will not buy? And to speak of Social Security and Medicare as being examples, we are now some $12 trillion in debt. Social Security is not solvent, Medicare is not solvent, and there's no reason for us to believe any projections on the cost of this program. The cost of this program will probably exceed $1 trillion, and ultimately I believe the program will involve Washington bureaucrats and the relationship between citizens and their physicians. So I will vote in favor of this resolution.
Thank you. Representative President in debate.
Thank you, Mr. Chair, and I too, like Representative Proctor, want to point out the fact that I think anybody that looks at this very good resolution and anybody's discontent with what passed yesterday or with the concept of what passed yesterday and tries to jump to the logical conclusion that somehow there's a connection between that and not caring for people's health care or not wanting healthcare to be reformed or not wanting healthcare to be available for more people is disingenuous at best. I think that because you have a disagreement in ways to get somewhere doesn't necessarily mean that your intent or your desire to have people be healthy and have access to healthcare is there. I know Representative Ray Winkle, Vasalinda, and a few others referenced every civilized society and kind of how they've gotten there. And I'm gonna venture real quickly just to talk about specific elements of my district and certain advantages that the population of my district provides for me as far as perspective globally. You know, a lot of times in these healthcare debates and the societies that we're talking about that offer that kind of or a version of healthcare that passed yesterday are referenced, and one of the ones that's often or some of the ones that are often referenced are England, Cuba, and others. And I can tell you, probably living in a district that has the majority or certainly a very large number of the very people coming from the very system that has socialized and or universal health care to its citizenry, Forget about, the benchmarks that are used to determine, well, one system has better healthcare than others are benchmarks like life expectancy and that sort of thing. But we also know that in certain societies, they don't have a Burger King and a McDonald's in every corner. So I think it's difficult to say, well, life expectancy is higher here, therefore their healthcare must be better. But I will tell you this, the very people that are coming from those countries that purportedly the media or others that are in favor of this kind of healthcare are trying to analogize, I'll tell you, they are amazed by the healthcare level in this country. The very people that had universal healthcare, or a version thereof. You talk to people from England, that they have the national health system, the NHS, okay? And there's a huge disparity between those that participate in NHS and those that are much wealthier that participate in private programs. And they all inevitably will tell you that the U.S. is a medical importing country, meaning people come into this country to have certain procedures, not out of it, as far as actual critical programs. So we can't completely disconnect the fact that the healthcare system, a market-driven system, has led to the highest deliverable level of healthcare. Now, what are we talking about? We're talking about actually having more people be able to participate at that high level, not water it down and get down to the lowest common denominator, which is what I think that mandate does. Representative Plakin's bill is very simple. It's simply a protection of the state of Florida from having something imposed on it that has not been vetted through, the consequences financially of which have not been fully determined and have bounced around 20 different times in the last month. So all this resolution does is say that Florida, as the gentleman who's in favor, who's opposed to this resolution stated, just like the other states are working with Walmart and working with others, just like Massachusetts said, this state allows Florida to, as a state, figure out its health care independently, going towards the same goal without having a one-size-fits-all mandate placed on us, without taking Florida into consideration. I support the bill, and I urge you all to support it.